multicultural community and the leaders of that community are involved in some of the state government planning. Now, as we know, we're going to find out about some of those plans over the course of the weekend. Sunday, I think, is the day that's scheduled. Associate Professor of Public Health at Federation University, Aziz Rahman, is I'll just grab your line. Aziz Rahman, good morning to you. Thanks for your time this morning.
Good morning, Steve.
Why do the multicultural community need to be involved in some of the planning and some of the explaining of this?
I know Australia is a multicultural country, so if we don't involve the multicultural communities, I guess we are missing an opportunity because these community leaders of these multicultural communities, they are really influential to impact any change in the community. So if the government thinks to involve them, the messages that government is saying and public health professionals are saying, that can be reached really well to the community.
Were they not included enough in some of the early messaging that came out?
They have what the government has done. They have did the translation of all of these messages, but just the translating the message is not enough because they need to be involved in listening to the community, what's happening there, and they need to be involved, these community leaders, in developing the strategies. And these messages need to be tailored to the community values, and it should be through the right people. There are lots of influential people in the community, say, for example, religious leaders or the community leaders or indigenous leaders. So they need to be really involved. And all of these leaders can be communicated continuously what's happening in the communities, what is the feedback, and what is the problem the community is facing. So the government can think, okay, what would be the next strategy and how people can comply more.
And the difference that would make, from the sound of what you're saying, is that the difference would be substantial in terms of that broader community in the multicultural end of our society being willing to sort of come on the journey with everyone else and not feeling left out, not feeling a bit like an afterthought.
True. And what the government can do, they can bring these community leaders, and that is a good time because this coronavirus is not going so quickly. So what Daniel has said regarding this COVID normal situation, so it will continue for a longer period of time. So if government thinks that they can form a body, probably at the state level or the national level, to bring all of these community leaders, and they can involve the councils and Victoria Multicultural Commission, they can involve them and they can form a big body to deal with these multicultural health issues.
What you're saying is that does this apply as much in regional areas, or is this mostly metropolitan, a CBD, Melbourne City sort of situation? I just wonder.
I think they can think of involving both metropolitan and regional. There is no difference in this, although the restriction and the non-compliance is more in the metropolitan region that we can see over the last few weeks. But I will say there's a right time to think of forming this type of bodies in both regions.
Is it too late to include multicultural leaders now, given that we're hearing that we will get some sort of roadmap announced over the weekend?
I think it's not too late because, as I told you, this coronavirus is not going to over soon. And government is discussing with the business people, but I'm not sure whether this multicultural community leaders and this community are involved or their voices is heard. So it's really important to involve them because we need to deal with lots of situations in the coming months. And if we can start focusing on this thing now, and they can be involved in managing other health issues as well in future.
We're talking with Dr. Aziz Rahman, Associate Professor of Public Health at Federation University, about the need to fully include the multicultural community in the messaging for compliance, particularly as we start to ease some of the restrictions. Aziz, can I ask you to put your epidemiologist hat on as such? How confident are you that we are making enough progress with COVID-19 and coronavirus?
I think we are really doing a good progress, specifically when the tests have increased But we just need to be careful because the flus, there will be lots of flu cases and there will be common symptoms of flu that may mimic COVID-19. Uh, Although we also need to bear in mind there could be some asymptomatic cases who can be COVID positive as well. So probably government should think in the future whether they can also expand this test to the asymptomatic people so that we don't need to face the third wave of COVID-19.
Is a third wave inevitable? I was looking at some of the figures for the Spanish flu outbreak 100 odd years ago. And there was the first wave, the second wave was worse, but there was a delayed third wave that came through. So I just wonder, is it inevitable?
Um, I'm not expert in modeling, but what I can see, there will be more cases. That is possible, and if we continue maintaining these public health messages, and if we continue doing the testing, we'll be able to capture what's happening in the community. Specifically, if we can identify who are those asymptomatic people, and then if we can target those people to do more testing and take preventive measures, probably we can avoid some of those third wave.
Thanks for your time this morning. Good to have you on.
Thank you, Steve.
That is Dr. Aziz Rahman, Associate Professor in Public Health at Federation University, and that need for including our multicultural communities in the messaging for greater compliance, multicultural leaders to get the information back to their communities. And if you think back, interesting what Aziz says about the translating, just it's not enough. And last time with some of the translations, apparently they were pretty ordinary translations as well. So they were ineffective for a significant part of the broader community.